Hello, good to be back again. Okay, today I'm going to talk about anterior cruciate ligament or ACL injury. Before that, Selamat Hari Raya Aidil Adha to our Muslim friends. Hope you all enjoy the holiday. What is ACL? ACL is a ligament inside our knee, which is situated at the front part of the knee. It is to prevent anterior or forward translation of the tibia bone in relation to the femur bone. This is to prevent anterior translation. Okay, it can be injured in contact sports and most common in rugby, football, or non-contact sports. What are the symptoms of ACL injury? Immediate injury, it will cause acute swelling over the knee joint, and chronic symptoms, or in a patient with chronic injury, the symptoms will be feeling of unstable of the knee joint during sports activity. The acute treatment of any sports related injury, especially ACL, will be price. Remember, price. Protect the area via putting a splint. Rest from any sport activity, but maintain a normal walking as tolerated by the patient. I is ice therapy. C is compression by putting a bandage. And E, elevate of the injured area. I recall again, price. How to diagnose the ACL injury? It can be diagnosed by the doctor via physical examination and also MRI. Of course, X-ray to look if there any avulsion fracture of the ACL ligament. If there's no avulsion fracture, the doctor will continue with MRI of the knee scan because they want to assess the meniscus integrity and as well as the ACL integrity and other structures of the knee joint. How to treat the ACL injury? First, if the ACL rupture, the doctor will assess if any other structure is injured. For example, if the patient have a ACL injury in combination with the MCL injury or LCL injury or meniscus injury, yes, the treatment will be ACL reconstruction. The next scenario is isolated ACL injury or pure ACL injury in a patient who is not athletes. Then the doctor will assess whether he or she involved in jumping activities, sports like basketball, football, and the occupation involved in heavy lifting and frequent ascending or descending staircase. And some patient, the hobby is skiing. Then this group of patients, we suggest to undergo ACL reconstruction. And the third scenario is isolated ACL injury in a patient who is not active or involved in sedentary lifestyle. And this group of patients can be considered to trial of conservative management or non-operative management via physiotherapy and rehabilitation program. Focus on the surrounding muscles of the knee strengthening, especially the hamstring muscle. Most of the ACL reconstruction surgery is done via arthroscopic technique. And to reconstruct ACL, you need to get a graft. There are three main groups, which is autograft. Autograft means we get a specimen or tissue from the patient body and then reconstruct using this specimen. Allograft means we get from a cadaver or dead bodies. The third one is synthetic, which is not via human tissues. It is created via tissue engineering technology. Most common autograft used by orthopedic surgeon. Autograft means we use the patient tissue to reconstruct the ACL. Number one, bone patella bone graft. Number two, hamstring tendon graft. Number three, quadricep tendon graft. Okay. ACL surgery involved in creation of tunnel. There will be a tunnel created over the tibia and also over the femur, as illustrated by the figure. The ligament will be passed through the tunnel and then fixed. There are two types of fixation, either via endobutton over the femoral side and endobutton over the tibia side. Another type of fixation is endobutton over the femur side and screw over the tibia. This type of surgery or technique of surgery depends on the surgeon preference and their training. Of course, most of the surgery technique will be discussed to the patient, and the advantages and disadvantages will be discussed by the surgeon. How long I will be able to return to sports, doctor? Before I answer this question, most of the patient will undergo a rehabilitation. What are the rehabilitation involved, doctor? Rehabilitation after ACL surgery involves a few phases. Phase 1, swelling reduction and pain management. Phase 2, muscle strengthening. Phase 3, coordination training. And the next phase will be sport-specific training. This rehabilitation program will last about 9 months until 1 year. Please don't forget to like, follow, share and comment on this video. Thank you.